but we are edging ever closer to that goal. Tulip Mazumdar, BBC News.
So if that Pfizer vaccine does prove effective, as we think it will be, the next hurdle will be administering it to hundreds of millions of people.
Yeah, and doses of this particular vaccine pose a unique challenge. They need to be kept at seriously cold temperatures. For long-term storage, the vaccine needs to be at minus 70 degrees Celsius. That's around minus 100 degrees Fahrenheit. That is beyond the capacity of many specialist hospitals, including the Mayo Clinic. The vaccine lasts up to 48 hours out of the deep freeze, but can only be taken out 4 times in total. And each patient will need 2 doses, 21 days apart, to build up their immunity.
It's going to be a mammoth challenge getting that vaccine into people's arms quickly. So let's speak to Jim Blumenstock in New Jersey. He's responsible for the United States Pandemic Response and Recovery at the Association of State and Territorial Health Officials. Jim, it's great to have you with us on the programme. I saw you doing a television interview 3 or 4 weeks ago, and you were making an urgent appeal for money. And you said that you think you require around $8.4 billion for health officials to distribute this vaccine. How much has Congress allocated of that money?
Up to this point, our members, the state and territorial health officials, have received around $200 million. That was principally for pre-event planning and readiness. Clearly, it is not close to being sufficient to really fund a robust response that will last months. In order to get vaccine to all the people that need it as quickly as possible, the public health infrastructure is all about scale, speed, and scope. This is going to be an extremely labor-intensive effort. As your piece before mine highlighted, it is not without significant challenges, some of which are logistics, other are technical, and quite frankly, there are issues around manpower availability and public opinion, all of which require an organized and well-invested campaign to ensure that at the end of the day, upwards of 300 million Americans have the opportunity to receive safe and effective vaccine in the most efficient and equitable means possible.
So while the Commander-in-Chief is texting about his legal problems and he's challenging this election result, what the Commander-in-Chief might do is start the heavy lifting in getting this money out there. But we'll park that for 1 second. I mean, this Pfizer vaccine would need to be stored at minus 80 degrees. How many states and local health authorities have the sort of cold storage facilities that they will need?
Well, deep freezers of that magnitude really are not plentiful. Vaccine typically is not stored at that ultra cold temperature. They're mostly refrigerated or normal freezers. So there are few units across the United States that have that capability. So that is somewhat of a challenge or a complication. But it's not a game ender. So we're developing workarounds. Some hospitals are actually going out and buying new units to install that can provide on-site storage. But the major effort here, or the tactical approach, is using thermal shippers. I best describe these as high-tech coolers. Boxes, if you will, that have all of the insulation, the ability to maintain the integrity of the payload, which is the vaccine, the use of pelletized dry ice. They have data loggers that have temperature recorders and GPS. So these are very high-tech mobile units that can safely and effectively get the product from the manufacturer all the way to that neighborhood in that community where the vaccine will eventually be administered. And there's
realistically, Mr. Blumenstock, realistically, how long do you think it's going to take for every American who needs one to get as many doses as they need of this vaccine?
So, well, I'm really not in a position to give you a hard and fast estimate, but I think with the promising information that we heard yesterday, I think it is quite possible that the very first doses of a safe and effective vaccine could be administered in a matter of, in a period that's measured in weeks, not months. But certainly in calendar year 2021 is when more vaccine becomes available, is when we build out the infrastructure sufficient to provide this level of service. I would say between the second and third quarter of 2021, you'll see huge penetration of vaccine availability throughout the country with many facilities, not only hospitals, but pharmacies, doctors' offices, public health clinics. The public health system will be standing up many traditional public health clinics that they do every year for seasonal flu or outbreaks like for measles or hepatitis. So that is really a full court press that will really require the public health and the healthcare system to give it its all to really achieve this national mission.